I'm Dr. Nantongo Josephine, a pediatrician and HIV coordinator at Chisi's Hospital. Chisi's Hospital is under Church of Uganda and is located in Rukunjiri district, southwestern Uganda. The hospital offers holistic care, which includes HIV care. The hospital offers HIV care to children and adolescents, and we have about 184 children and adolescents on earth. During the COVID-19 lockdown, we faced a number of challenges. Number one, we had missed opportunities. These children missed their appointments because they were unable to transport themselves. They were unable to walk long distances to the hospital. And because of that, their viral load increased and they also developed opportunistic infections. With the opportunistic infections, you find that some of these children are admitted. We lost 2 children because they had the advanced opportunistic infections. With the lack of transport, we lost some of our patients and we had poor retention. And because of that, we are also unable to take off samples for viral load. So we had low viral load uptake because most of the children were represented by adults. We mainly received their parents or caretakers who were able to ride bicycles or who were able to walk long distances. We are also unable to carry out intensive adhesive counseling because the children who had high viral load, who had poor adherence, were unable to come to the facility. We also experienced stock out of HIV or anti-drugs during the lockdown. This was mainly because the joint medical stores was unable to supply us drugs in time. And because of that, we had to give out drugs on short stocks and children had to come on short intervals, which was difficult. Then we are unable also to carry out our usual community drug distribution, which we usually do where we take drugs to the community, because the facility didn't have a motorcycle to go to homes to do door-to-door drug refills. At the same time, we realized that some of the children developed malnutrition because they were unable to come to the facility to pick the usual seasonat which they take when they have moderate malnutrition. The other thing we noted that we had increased stigma because children were not having their usual ongoing counseling. And we also had an increase in mental illness because we didn't have the social gathering that like earlier, and these children were out of school, so they had stress, and there was also increased poverty in the community. So the parents were also under stress, which meant that the children were also stressed, which increased the mental illness. To try and correct this, we had volunteers that offered to go to the community and either ride bicycles or walk long distances and carry drugs to some of these children. Then also the hospital asked permission from the RDC, Resident District Commissioner, to allow us use any other hospital vehicle to visit these patients and to bring them to hospital. Then we had also well-wishers who offered to support art clinic staff to visit these children using motorcycle. That's how we managed to go through the lockdown. Thank you very much.